Hi there! Have you ever caught yourself thinking, what is this strange little thing on my skin? Maybe it's a tiny white bump under your eye that looks like a pearl, or a soft skin growth on your neck that did not seem as noticeable before. Trust me, you're not alone. That kind of question comes up a lot, and it's completely normal. Our bodies love to surprise us with things that can seem a little scary at first. Today I want to talk to you about skin growths, what they might be, where they come from, whether or not you should worry, and when it's time to see a doctor. Think of this video as our cozy little chat, where you get a ton of helpful info and as little stress as possible. Let's start with those tiny white bumps that often show up on the cheeks and around the eyes. Milia. They're not blackheads and they're not pimples. They're small cysts filled with keratin, the protein that makes up the top layer of the skin. They can appear on anyone, babies, teens, adults, but they are especially common in people who use heavy creams or makeup, or those with drier skin. There are two types of milia: primary milia, which show up without a clear reason, and secondary milia, which develop after burns, peels, skin trauma, or inflammation. Even though they are totally harmless, many people are bothered by how they look. Removal is done in a dermatologist's office with a sterile needle and gentle pressure, with electrocutory or laser. Sometimes a fractional laser is used, especially when there are multiple milia. And please, don't try to pop them yourself. They can lead to infection, scarring, or even more serious issues. Here's a little tip. Using retinol helps renew your skin and can prevent milia from coming back. Just be patient. Results usually show up after 3 to 6 months. At home, focus on gentle cleansing with no scrubbing, double cleansing to remove makeup, and staying away from pore clogging products, especially those with lanolin, petrolatum, dimethicone, waxes, or shea butter. Keep in mind, trying to remove milia on your own can lead to infections or scarring. They can also be a sign of either too much exfoliation or not enough. Also, avoid rubbing your skin. Don't scrub under your eyes or use harsh exfoliants. Now let's talk about papillomas, also called skin tags. These are small, soft little growths with or without a stalk, often found on the neck, armpits, groin, under the breasts, and around the eyelids. They tend to show up in areas where the skin rubs together, in people who are overweight, have insulin resistance, or are pregnant. Genetics and hormone changes also play a role. Most of the time, people notice them by accident, on their neck, underarms, or under the breasts. Sometimes they are soft and movable, other times more firm. In most cases, they are benign and not dangerous. They might not bother you for years, but if they get inflamed, snag on clothing, or start bleeding, it's time to take action. The best option is to have them removed by a dermatologist using laser, radiofrequency, or electrocutory. For delicate areas like eyelids, gentler methods are preferred to avoid scarring. Important note: what looks like a papilloma might actually be something else, like a wart or even something malignant. That's why it's so important to see a doctor before removal. Now onto syringomas, the little bumps under the eyes. These firm, pale bumps are often confused with milia, but they are actually enlarged sweat gland ducts. They almost always show up under the eyes, and yes, they are tricky to get rid of. Removing syringomas is not simple. They sit deep under the skin, and aggressive treatments can leave scars. That's why dermatologists usually use gentle laser or radiofrequency. Sometimes it's best to leave them alone, especially if they're small and not bothersome. But if they are, treatment usually involves a few spaced out sessions with very mild settings to protect the delicate skin under your eyes. Interestingly, systemic retinoids can help too, but they are rarely prescribed and only under a doctor's supervision. Seborrheic keratosis, the coins of aging. If you're ever seen rough, waxy-looking spots that are brown or almost black, especially on your chest, back, face or scalp, you might be looking at seborrheic keratosis. These often show up in people over 50. They are harmless, but they can get irritated or inflamed, especially in places that rub against clothing. They're easy and quick to remove at a dermatologist's office using laser, cryotherapy, or gentle abrasion. Laser is great for treating larger areas in a single session, especially if there are many of them. For the face, gentler methods are usually better to avoid scarring. Sebaceous hyperplasia. These are little yellowfish buttons with a central dent, usually found on the forehead or cheeks. They are overgrowths of sebaceous glands. They are more common in people with oily skin, especially those who spend a lot of time in the sun or use heavy creams. Treatment involves laser or cauterization. The tricky part is that they often come back, so it's important to plan treatments for fall or winter, when UV levels are lower. People often report flare-ups when using oily creams or oils, so a proper skincare routine is important. Retinoid-based products help reduce their appearance and slow down the formation of new ones. Intradermal Nevi or skin-colored bumps. These are basically flesh-colored moles. People often assume moles should be brown, but many of them don't have pigment at all. Intradermal means that moles' pigment cells are located in the dermis, under the skin's surface. That's why they appear like soft domes instead of raised spots. They may contain pigment or tiny blood vessels, but many are just skin-colored. They typically appear after childhood in your 20s, 30s, or 40s, and that's completely normal. Even though they are harmless, some people ask to have them removed for cosmetic reasons or because they are in the way. Removal can be done surgically with stitches or by shaving them flat to the skin. But keep in mind, shaving does not remove all of the mole because part of it sits deeper. If you ever heard home remedies using celandine or hydrogen peroxide, forget about them. They can actually make things worse. These moles can grow hair too. There's a myth that a hairy mole means it's cancerous, or the opposite. The hair means it's definitely benign. In reality, hair does not mean anything either way. It's not linked to cancer. Dermatofibromas. These are small, firm nodules that usually appear on the legs. You can often recognize them by the way they dimpled inward and when you press on them. They tend to form after insect bites, small injuries, or inflammation of hair follicles. They are harmless, but can itch or feel uncomfortable. Removal is optional, but keep in mind it may leave a visible scar. Sometimes it's better just to observe them. Angiomas, bright red dots. Another type of skin growth I often asked about is the cherry angioma. These are small, smooth, bright red bumps that can appear anywhere on the body. They usually show up with age. You rarely see them in teenagers or people under 20, but once you hit 30, anything's possible. Some people have just a few, others have hundreds in all different sizes, mostly due to genetics. Because they are so bright red, they can be alarming if you nick them while shaving. They tend to bleed a lot. But overall, they are not dangerous and aren't linked to serious diseases. Sometimes people confuse cherry angiomas with spider angiomas. Cherry angiomas are smooth and well-defined. Spider angiomas have a bright red center with little blood vessels radiating out like spider legs. Spider angiomas are more common in kids, but also appear in adults. They can be related to high estrogen levels, for example, during pregnancy while taking birth control or in liver conditions like liver failure. Don't panic though. If a spider angioma showed up due to a liver disease, this will already be other warning signs long before that. As for cherry angiomas, they are so common that we usually don't treat them unless they are bothering someone cosmetically. If they are, laser removal is super easy. Cysts and dilated pores of Weiner. These are firm bumps, sometimes with a black dot in the center. Inside there's keratin. Cysts can get inflamed, infected, and cause real trouble. They can only be removed surgically, and it's essential to take out the entire sac. Otherwise, the cyst will grow back. Sometimes doctors do an ultrasound to check how deep the cyst is. Now you might have seen something that looks like a giant blackhead. That's probably a dilated pore of Weiner. You've probably seen them go viral on TikTok. Watching them being extracted is oddly satisfying. But if you just squeeze out the contents, it almost always comes back. The only permanent solution is to surgically cut it out and stitch the skin so it heals properly. Even though it looks like a huge blackhead, it's not the same. The skin won't close up if you just remove the plug. Why you shouldn't remove growths at home? Let me tell you about one of my clients. She tried to remove the Milia herself with a needle like she saw online. A few days later, the skin got inflamed, then crusted over, and eventually left a scar. All of that could have been avoided with a quick visit to a professional. At-home removals are always risky. Infection, scarring, misdiagnosis. Remember, if you're unsure, don't touch it. See a doctor instead. What you should know about removal methods. Electrocautery uses electricity to burn off the growth. Leaves a tiny scab. Laser, CO2 or fractional. Precise and safe, good for delicate areas. Cryotherapy freezes the growth with liquid nitrogen, might require a second round. Radiofrequency, a gentle option with no scarring. Surgical excision, used for larger or suspicious growths. The tissue is sent for testing. When should a growth be removed? If it gets irritated by clothes or if frequently injured. If it grows, itches, or changes shape. If it causes cosmetic discomfort. If it's in a sensitive area. When should you see a doctor? If the growth is painful, growing, or bleeding. If it changes in shape, color, or surface texture. If it looks nothing like other moles or spots. Follow the ugly duckling rule. If something stands out, see a dermatologist. I know that changes in your skin can be scary, but it's important to remember that most growths are harmless. The key is to check in with a professional, avoid self-treatment, and take good care of yourself. If you found this video helpful, give it a like, subscribe to Metodica Med Spa channel, and tell us in the comments, have you had skin growths like this, and how did you deal with them? See you soon! And remember, your skin is a reflection of your self-love.